Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Ricky Johnston from Gastroenterology Associates of Columbus. And today we're talking about a topic we have talked about before, and it is colonoscopies. Welcome to the show, my friend. Nice to see you.
Nice to see you too, Troy.
Okay. There are lots of concerns out there when, especially going into medical offices and having procedures. Where do we stand when it comes to the safety for your patients?
Well, obviously that's at our forefront. For us to resume practice and start seeing patients, we really focused on having a good plan for safety. So we're doing a few things in our practice. We're testing patients when they come to the door, screening them with the usual questions about exposures, checking their temperature. We're asking their family members to stay in the car and wait on them. Our office staff are masked, we're masked. We're asking patients to wear masks except during the time of the procedure. So we're doing everything we can from a safety standpoint.
And I think that's really important.
Yes.
Now, people, I know when I go into the medical offices and things like that, one of the questions I ask is if I'm feeling any of the symptoms of maybe this, I may have COVID, but I don't actually have COVID, I might have a bit of a flu or something like that. Are those type of patients still able to come in?
Yes, and I didn't mention in the safety part of that, but we actually are screening with testing now beforehand.
Oh, you are?
So we're requiring, and that's, we felt like that was important for our safety, for our patient safety, for our staff safety, and the Department of Health has actually suggested it as part of their guidelines for practice too. So we're having our patients get tested within about a 4 to 5 day window beforehand. So generally, in addition to the screening and temperature check when they come to the door, we also will have a recent COVID test on them. And so that's been very helpful. So yes, the symptoms, as you suggested, could be varying. I mean, the list of symptoms with COVID is extensive. And
they're the symptoms of a flu.
Yeah, exactly, which is tough. So it makes it tough to screen for just on that. And so that's why some people are asymptomatic. We've had a lot of people, obviously that's been the big problem with this is asymptomatic spread. And so we feel like testing is catching those. And we've actually had some people turn up positive in pre-screens before the procedure, and we were able to push them out and
catch them and help them sooner.
Right.
I think that's amazing.
And keep them out of our building.
Exactly,
to
and
avoid
that's the
exposure
super important thing.
Yes, exactly.
All right, let's jump into the main topic, which of course is colon cancer and having the colon cancer screening.
Right.
At what age should one be looking at having their screening done, and what is a screening?
So there's different ways to screen for colon cancer. I'm a gastroenterologist, so we perform colonoscopy, so that's our preferred method. We think that's the best, and I think that's generally pretty well accepted. Other ways that you can screen for would be by doing testing on the stool for blood, what's called a flexible sigmoidoscopy, which is a scope, kind of like what we do, but it's only looking at part of the colon. There's some x-rays that can be done, but generally none of those are as good as a colonoscopy. So if you've got access to a colonoscopy, if you have a gastroenterologist in your area, that's the best way to do this. And age, we tend to start at age 50 historically for everyone. Those ages have shifted sooner than that for certain demographics or certain, based on family history or a race or maybe symptoms wise.
Yeah.
But age 45 to 50 is generally when.
I think you and I talked once before. Is it the African American community need to come in sooner?
Yeah. So it's recommended for them to start at age 45 because for whatever reason they're a little bit higher risk. And so I touched on family history too. That's also very important, particularly if you have a first-degree relative who is afflicted with colon cancer, particularly at a young age, because those patients we actually start around 40 or sometimes even sooner. So if you have a family member who is diagnosed with colon cancer around age 45, we would start that at 35.
Yeah, well, that's what we did with me,
right?
Yeah,
exactly. Yeah.
Now, just everyone at home who may be nervous about having a screening or having a colonoscopy, the procedures, I think I came in, it was an hour?
Yeah, well, you're there about, probably an hour, hour and a half, sometimes 2, depending on flow and how our day's going. But the procedure itself is generally 20, 30 minutes.
Yeah,
so it's pretty quick and easy.
It's not very long at all. And best to have all your medical insurance and everything checked out to make sure you're covered.
Yeah. And most people for their age 50 screening are going to be covered at 100%.
Well, as always, thank you, Dr. Ricky. We really appreciate it.
You're welcome.
If you want to find out more information, there it all is up on the screen for you. There it is, Gastroenterology Associates of Columbus. And today we were talking all about colon cancer screening. Back after this short break, everyone.